We'll be meeting with a variety of congressmen and congresswomen, as well as the 2 U.S. senators and their staffs, to articulate our position about restoring the child health insurance program and getting that reauthorized for a full 5 years, which in all honesty has happened ever since 1997 when the program first started out. It's always received bipartisan support, but unfortunately in Congress there's such a toxic environment that this program has lapsed. We're very worried that Congress will be proposing to cut significantly on Medicaid reimbursement for families and for children. If you recall, last year, Congress and the House passed an $800 billion cut over 10 years, which would have been devastating for children and families. And we have to make sure that that bill never sees the light of day. And also, we're playing offense now on the potential to cut Medicaid. Medicaid affects many, many children. You just are not poor if you're on Medicaid. Middle-class families also can avail themselves of Medicaid for many children that have a devastating illness, or it could be through an accident. So in the blink of an eye, you're just one diagnosis away from some incredibly bad news. Your health insurance runs out. What do? Medicaid is that safety net for children and for families. To cut $800 billion over 10 years would be devastating. Programs would have to be cut. Benefits would be reduced. We can't do that to our nation's children. We're much better than that. And so that's what we're fighting about. And that's why we're going to D.C., to put a human face on these children, that these are just not numbers like $800 billion. It affects real patients and real children. And 33 million children around the United States are on Medicaid. And so that's what we have to impress upon our policymakers, that this just isn't something that is covered by would affect just a few people. Many, many millions of children and families would be affected. We look at ourselves as the spokesman for these children that are really lost in the medical care marketplace, that really people don't focus on kids with medically complex and fragile needs. And we're actually the lobbyists for those kids. So that's why we're going to Washington.